Sara, founder of Skin to Skin, and welcome to Skin to Skin Face to Face, where we do a deep dive on all things skincare around pregnancy, trying to conceive, breastfeeding, and postpartum. And we're here with our medical advisory board, Professor Caitriona Ryan, our GP advisor, Dr Raj Arora, and our beauty editor, Bridget March.
So, should we talk about injectables?
Let's do it.
Yeah, it's kind of the one thing. I mean, do you guys get asked this in clinic? Like, can I have injectables? Can I have tweakments during trying to conceive, during pregnancy and postpartum?
You know, we do a thing called Ask ID. It's Ask Institute of Dermatologists, and like every single round, we ask people if they have questions to send in. I don't know how many times you see, is it okay to get Botox during breastfeeding? I think most people know that we can't do it during pregnancy. Mm-hmm. But that's a common question, and about everything during pregnancy and breastfeeding, not just Botox. They ask about every single cosmetic procedure. Yeah, because I think they have that. They find out they're pregnant, and they're like, "Oh, what can I do now for my skin? I'm gonna have to give up all these different things." So there's a bit of a panic in not everyone, but in a certain portion of patients. And then the same with breastfeeding. I think there's a lot of misinformation out there about what you can and can't do, or what is safe and isn't safe as well.
So let's start, I guess, at trying to conceive or conception when you weren't necessarily trying and you just had your Botox appointment, and then you found out you're pregnant and you're feeling really guilty for having had Botox fillers X, Y, and Z. You know, is this something that's actually been tested, or is it a case that like they're not going to test these things on pregnant women, so we don't know if they're safe or not?
So you can't do the test. You can't do trials. It's unethical on pregnant women. Exposing a fetus or to potential. Them, I suppose the good news is there's a lot of retrospective data, because so many people don't even know that they're pregnant for up to 3 months. So lots of people have had Botox when pregnant, inadvertently, or I've had a few patients who tell me that they did their pregnancy test that evening, and you know that they knew when they came in.
I've had that.
Yeah.
Oh my God.
Your friend has done it to me twice.
Look at them tricking us, you know?
And the good news, or what you can reassure somebody if they've had it, is the molecule is so big that it shouldn't get through the placenta. So in the registry, in the retrospective data that we have, there hasn't been anything shown to be a problem. We still won't do it. It's on my consent form. You're not meant to do it when you're pregnant. But if you were pregnant and not knowing you were pregnant, got your Botox, nothing to worry about.
Yeah, I think that's the really important point, is that, you have women coming in panicking, saying, I didn't know, I had my filler done, and Botox on it. That, don't worry. So we don't have the data that says it is unsafe per se. But I think, our insurance as medics and doctors is not going to cover us injecting somebody with filler or Botox when they are pregnant. And I think, we have to practice safely. That's really important. And so we have these guidelines for a reason. And if something's not safe and the risk is potentially not, greater than the benefit, we're not going to do it. And that's why I don't inject. And I think most sensible, practitioners and doctors will not be injecting, obviously, in pregnancy.
I don't know any injector who injects. And it is like, pregnancy is the one time it's err on the side of caution time
with everything.
And that's why Skin to Skin is so great. You just take that unknown out of the equation.
So same goes for all kind of injectable, because there's so many treatments now, aren't there? There's all the different skin boosters, and polynucleotides are kind of having their big moment at the Mo. So is it just steer clear?
I suppose there's things that we know have to be safe because of what they are, like things like PRP and lasers. They've done testing that the pregnant uterus can't be exposed. But my clinic does nothing during pregnancy, and it is, again, it's our our malpractice insurance and everything else, because things go wrong in pregnancy. 2% congenital anomaly rate, and women will always think it's that one thing that they did. So it's 9 months, and it's 9 months we can just leave everything alone. Now I think people differ a lot on what they'll do
in breastfeeding.
We can talk about that, but pregnancy, we do nothing apart from pregnancy facials in our clinic. And pregnancy facials are totally okay as long as the ingredients that they're using are pregnancy safe.
Absolutely. And I think that's the other point to make, is that when patients come in panicking saying, oh, I can't have my Botox appointment, what am I going to do? Now is, where we can talk about things like skin to skin. So you've got other topical active ingredients that are safe to use. You've got the peptides, you've got the, great ingredients that are going to help with that collagen. So you can still keep on top of things without panicking that your next Botox appointment is not in 3 or 4 months time. You've got to wait till the end or after breastfeeding, whatever it might be. So there are other options out there. And I think we should obviously promote those because it's important.
Absolutely.
So many great topical ingredients.
One of the other things, a cheat thing maybe for people who are on an IVF journey, a lot of my patients will come in before the transfer. So they get their Botox done ahead of the transfer. So they're good for the first 3 months if things are successful. Yeah.
And beyond topicals, in terms of alternative treatments you can have that are safe in kind of advanced facials but pregnancy safe, what might that look like? Are we talking sort of LED, needling, light needling? Is there anything you would
the pregnancy safe facials that we have in clinic are very much ingredient based. They're on things like your hyaluronic acid, your moisturizers, your peptides. You might have an azelaic acid based facial, for example, to brighten the skin, vitamin C facials. There's so much out there.
But not so much tools and
so
gadgets.
We're keeping away from anything that is a device. We're keeping away from LED lights. We're keeping away from all those kind of things just because err on the side of caution. We don't know. Skin is more reactive and sensitive in pregnancy, and it's better to be safe than sorry. That's how I practice.
What about peels?
No.
And actually peels, for the vast majority of them, we wouldn't consider some of those ingredients pregnancy safe. We do no interventions in my clinic at all, apart from the facials.
If you're pregnant, just a pregnancy facial is as far as we'll go. And now we can obviously offer some skincare. Before it was like choosing the ingredient or telling them what to go for.
I had loads of I love facials, and I was turned away by 2 separate places because they were like, oh, we don't have products that are safe for pregnancy.
Really?
So they wouldn't even go near me. So literally walked in ready to go, and they're like, no, sorry, kicked me out.
Wow.
Bring back your skin.
I know, I'm gonna go knocking on those doors.
Yeah, you can do facials with them for sure.
Yeah, absolutely.
How about thinking about fertility and when you're trying to conceive? Are injectable treatments ever going to have an impact on your fertility?
I think given the data and the evidence we have now, there's no evidence to support that they would impact your fertility at this stage. So if someone's trying to conceive, they can go ahead and have their Botox, their fillers, their polynucleotides. If and when data comes out, we are always guided by medical data and evidence-based medicine. If something comes out to say you shouldn't be doing this because it's going to impact your fertility, then of course we follow those guidelines. But in my practice, if you're trying to conceive, you come in and say, oh, I'm trying now, it's not going to stop me from giving you Botox. Unless you say to me, I'm on a IVF drug or a medication, or I had a transfer, for example, the day before, then I'll say no, because that's basically the time which you could be conceiving. So. No, so the answer is they're safe in that regard.
Yeah, and if you think about, say, fillers, that's hyaluronic acid, which is a naturally occurring substance that it makes up a lot of our actual skin. So if we think from a mechanistic, if we go back to the basic science of it, there should be no issues for that and fertility. Or sculptors in the filler I use a lot of. Polynucleotides, same. If you look at the science behind them, botulinum toxin, the way it acts, it should have no issue. It should have no issue for the actual fertility of a person. Through its mechanism of action. So
same with exosomes, where they're just calling to cells. So again, it's not really affecting organs per se. It's more working on what you already have and calling those cells into action, right?
So in the absence of data, because I think it'll be very hard to collect that data, I feel very safe with those up until the transfer happens.
Yes.
Okay. And postnatally, whether you're breastfeeding or not, I don't know if this changes things, but how might you respond differently to your fillers and Botox that you would normally have before? Could you respond differently?
You could, yeah. So you could be, it's very unlikely with fillers, I think, and with polynucleotides and and skin boosters, because they are hyaluronic acid and you do produce that naturally in your body. But I think with things like chemical peels, lasers, other treatments, definitely you can have a completely different, reaction to those. We have to be very mindful. I do the patch test again. So if they've already had laser treatment before, I will redo a patch test if I'm doing a laser or a needling after they've given birth. I know Caitriona is different to me, but I also don't do anything in the first 6 to 8 weeks postpartum. So that's the time when your hormones are a bit up and down. I'm a bit mindful. Even Botox, I just say wait till the 8 weeks are over. Your skin will be less reactive, and then I go in. So definitely Botox. Postpartum's fine. I will go in with lasers and things if needed. The only thing that I don't do postpartum immediately, I'd probably say 3 months or so, is the fillers, because your face can be different. You might have retained more water, might be more puffy. So I just wait for that to all settle down, and then I'll go in with fillers if that's important, if that's what they wanted. But yeah, there's definitely a consideration to be made postpartum, because things change, skin changes, our hormones change, and we come out almost different people, don't we?
And I totally agree on the sensitivity part of things as well. People's skin, we've talked about the changes in pregnancy, but people's skin takes a long time to, at least 6 to 8 weeks, to sort of settle down. That the sensitivities, and the hormonal acne can go on for a long time, or can start and never stop. When it comes to the interventions, I treat breastfeeding women as I would treat non-pregnant women in my practice, and I don't mean my way is the only way. Everyone is different in the way they practice. I would hate for anyone to be rushing back to stop breastfeeding just so they could do things again. We have a lot of data out there as well. So I have patients who are almost dropping into me on the way home from the hospital to get their Botox. And I'm not joking. I've had people arrive in and there's almost milk, running down their t-shirts. They're so desperate. Now, these are my frequent flyers who, they get pregnant. They're like, I can't get Botox for 9 months. And they are so tired by the end of their pregnancy. They can't wait to get in and have their Botox and feel like themselves again.
Right.
And I do think it helps people get their mojo back. That tired face, looking back at them sort of changes.
And actually, on that point, looking at other countries, there are countries which will have packages. So you're just giving birth and your doctor comes in, facial, Botox, filler. So
tummy tucks.
By no means, I definitely practice it more defensively, and I'm definitely a bit more reserved with that. But there are definitely doctors globally as well who will go in and inject, and there's not been any adverse effects from that, from what I know. So actually, it is safe. And let's be honest, if you're breastfeeding for 2 years, are you not going to have a treatment for 2 years? That's also something to
So there's no research into how these kind of injectables can get into breast milk or anything.
Well, actually, LacMed have things on Botox. So I feel very safe looking at the science. Now, there isn't a huge amount of data, God no.
Yeah, we need more, definitely.
We don't, I don't think Allergan or any of the botulinum toxin companies are going to start running trials in breastfeeding women. It's not in their interest. So will we ever get, randomized or robust data? Probably not. Yeah. It's more retrospective data over time. But I think when it comes to IPLs, lasers, polynucleotides are great for people just straight after their pregnancy as well, just to jazz up their skin again. We use a lot of polynucleotides in our practice too. So for my patients, after they've delivered, they're good to do whatever they need to do.
That's good to know. Yeah.
What about laser hair removal? Can you get that when you're pregnant, or is that something you need to stop as well?
You need to stop, yeah.
Really?
Yeah.
Wow.
And actually, often women who've had very successful laser hair removal treatment, they become
really hairy
again after.
Yes.
So there's
I'd be
no
gutted.
point anyway. So
wow.
It's all the hormones again. So that happened to me. I got really hairy again. And I was I had 13 sessions to go to this bushy Indian hair that I have, and you can tell from my brows that I have lots of hair. But I then my second pregnancy got more hair, so I'm going through laser treatment again now for hair removal.
Wow.
So that can happen.
Yeah. Wow.
Isn't it funny how you're reborn as a mother, in a totally different person? Fascinating. Oh, thank you so much.
Thank you.
Thank you so much. And I hope you enjoyed this episode of Skin to Skin, Face to Face.